Welcome to the CHC podcast. I'm your host, Julie Fisk. Today I'll be talking about Valencia County Hospital, a new hospital in Los Lunas, New Mexico, with Jim Kendrick, CHC President and CEO, and Tammie Hulett, CEO of Valencia County Hospital. So, Tammie, tell us a little bit about Valencia County Hospital.
Valencia County Hospital is a 11-bed hospital. It has a full-service ER, two ORs, two endo suites, full X-ray, radiology, CT, MRI, fluoro, full-service lab. This is a full-service acute hospital. We will be teaming up with Loveless to provide shared services for the medical, and we will be taking care of approximately 80,000 plus people in Valencia County.
So, Tammie, how did the hospital come about?
The hospital came about with the community supporting by financials means. They put together tens of millions of dollars in mill levy monies. There was a $50 million appropriation that was put together by the state. And then through the commitment of the county and through CHC, Loveless Health Systems, and the county getting together and putting it into place.
So, Jim, how was CHC involved in this project?
So this type of hospital is right in our wheelhouse. We focus on rural hospitals. We focus on trying to bring as much care to the rural communities as we possibly can. And how this started was an RFP process by Valencia County. Like Tammie mentioned earlier, Valencia County has wanted a hospital for 20 years. This is a long project they've been trying to do. A mill levy has been in place. They've raised taxes. You had the governor come in and say, for counties of a certain population that don't have a hospital, we want to give funds to help a hospital. So everything came together through that RFP. CHC responded to the RFP and said, the way you're asking, it's going to be difficult for people to answer you, but we're going to tell you why. And I think we were the only person that or the only company that responded. And when we brought us in to talk to us, they said, okay, tell us why you didn't answer it the way we ask it. And we told them, well, because the way you're asking it makes it difficult for people to be able to deliver what you're asking for. But what you want is a hospital. Let us tell you how to get a hospital. So we did that. We worked with the county, have a very good working relationship with the county. And that's evolved to being able to get to a spot where we could show them a path where they were going to be able to use the taxes dollars that they raised through the mill levy, the dollars that the governor had put together through the state legislature, and come together and cause them to get their hospital that they've wanted desperately for 20 years. So we're very excited about that.
So, Tammie, how is Loveless involved?
Loveless and CHC are in a relationship to bring a higher level of care to Valencia County. We will be able to bring specialists out of the Albuquerque market to Valencia County, and this is going to be able to create lots of services that people would normally have to drive 30 minutes or an hour north just to receive service.
So, this story is very different from what we're hearing in the news today, specifically about hospitals closing. How did you make this happen?
Well, one of the key components was what I was talking about earlier with the state. The state, the governor of the state, and the state said, we don't want our communities of a certain size to not be able to have medical care. We want them to be able to get a hospital. So they put significant dollars on the table to help cause this project to move forward. At the beginning, it was $50 million for counties of a certain size that didn't have a hospital. But even since then, as we've moved forward, we have had a lot of legislative hurdles that we've had to work through. So Tammie's been instrumental of working with the governor's office, working with the state legislatures to try to address those hurdles as they came along. So I think that is a unique component to it. So Tammie, you want to speak to some of the things that we've had to overcome to make it work through that collaboration with the state?
Sure, and that is hurdles anything with just making sure you have enough dollars to even get the hospital operations over the finish line. I've worked with not only the healthcare authority for the state of New Mexico, but also with the hospital association. Many of the things that I have been working on in New Mexico is maintaining access to care in rural communities, not just Valencia County, but all rural communities, making sure that you have a voice at the legislation, making sure that you're talking to your leaders, and making sure you're talking and letting the state know what's going on. I think one of the differences that I've seen in New Mexico is that communities are having a voice. And when communities have a voice, you start seeing things happen. This is a community who has wanted a hospital for over 20 years, and now it's happening.
And Tammie, you have a personal connection to this community.
I do, I do. I raised my children in the Valencia County. My children went to school in the 80s and 90s. My mother still lives in Valencia County. I have sisters and brothers and cousins. And so coming back to Valencia County is like coming home to me.
So, Jim, what does this hospital say about the future of healthcare in New Mexico?
Well, it shows that when all parties come together and work together, you can deliver high quality care in a community and serve the population. You know, when you look at the patient population and you say it's not going to have a lot of commercial, okay, well, that means that it's going to have some type of support, like a mill levy. When it has problems, it has to have the vehicle to work with the state and say, we're trying to deliver care here, help us work through whatever problems. And the history of how we've came together to make this hospital happen is the history that's going to cause it to be successful in the future. So far, every time we've ran into a problem, we've just been very transparent. We put it out there and we show everyone exactly what's going on and say, this is the hurdle. How are we going to get past it? And it takes the local county legal department. It takes the local county leadership. It takes the state legislatures. It's going to take CHC. It's going to take Lovelace. But literally, every time you run into something that you say, all right, this is going to cause us difficulty in being able to deliver care to this community, we just tell everyone, this is what we're seeing, this is what we're facing. How can we work around this problem? And so far, that's what's been the magic success for making this work is people say, well, we could probably do this, or let's do it this way, or let's change this rule. This rule doesn't make sense for this particular situation. Let's see what we can do to change the rule so that it's not going to cause problems. So that collaborative effort is what's going to continue to make this work.
Well, how is this project an example for other rural communities?
Well, I think you can learn from it from both sides. You can learn from it from what it took to make it work, but you can also learn from it for what you're missing. So if you're a small rural community and you want a hospital and you say, well, we want a hospital, well, you can go look over here and say, well, it took all of these things to make it work. Well, do we have all of those things lined up in our situation? And it is a magic scenario where you have everyone aligned and you don't always have that. So there's many rural hospitals or many rural communities that would say we would like a rural hospital, but they don't have all those things aligned. So if they were trying to get there, like I said earlier, just one of those going away would make this new hospital. You don't see a lot of de novo hospitals in a rural market, in a predominantly Medicaid, Medicare market. Okay, to make that work, you have to have all of those pieces aligned. So if you've got a community out there and you say, hey, we want to make a hospital come to be, well, if you don't have those components, you're going to have to chase those components and see if you can put them together. The other side of that is if you have a rural community hospital that's struggling, you could say, we want it to maintain, we don't want it to go away. Well, what is it missing? Something in that continuum, the care provider, the management, the local leadership, the local government, the state government. If you're missing some of those components, then now's the time to start working to backfill those holes so that you can work for future sustainability for your hospital. But a rural hospital can work if everyone is backing it and trying to make it happen to deliver care for the community.
Well, thank you so much for all this important information and congratulations. Sounds like a happy ending for Valencia County.
Definitely.